First of all, there is an old myth that you should not give up on a patient until you give them immune therapy. We have more and more knowledge in the medical literatures that immune therapies do not work in certain cancers. And that data is rapidly incorporated into our care pathways. There is a problem in giving immune therapy to patients that have certain cancers with specific mutations, because immune therapy may actually worsen the patient's survival and may actually make that cancer more aggressive. In addition to the fact that immune therapy is just like any other therapy, has side effects. When we take the brakes off our immune system starts attacking normal organs. So that is a limitation of giving immune therapy to patients. Certain patients should not get immune therapy because they already have an immune-mediated disease. So their immune system is already, out of order. Giving them immune therapy might just stimulate that pathology that already exists. So that's one way to mitigate costs associated with unnecessary immune therapy. So following strict national guidelines of cancer care is extremely important. The second very important development in controlling the cost for immune therapy has just happened a few months back, when Novartis agreed with one of the larger insurers in Germany to give the money back for immune therapy that did not work in a patient. So Novartis has a CAR T cell therapy that has a cost of about $500,000 per patient. And Novartis agreed that if that patient dies or his disease or her disease progresses within a certain time limit, they will give back the money to the insurer company. Obviously, that type of arrangement, value-based arrangement, should be translated in the United States. We strongly believe that the patient should have a money-back guarantee when using medication, just like we all as consumers have money-back guarantees when we buy a product that does not fulfill the promises. So in addressing the high cost of prescription medication, immune therapy, and any other medications that are out of the reach, we should not bankrupt the patient, and we should not bankrupt the system with bad drugs. If the drugs do not fulfill their promise, the money should be reimbursed to the patient and insurer. This can happen because we as oncologists follow national standardized guidelines. So if the promised drug is the drug that we use in condition and under certain circumstances that were approved to use that drug, if the drug doesn't do the job, the drug company has to reimburse the money. That's one way to reduce cost. The second way is to provide price transparency. So a patient have the right to know how much an immune therapy costs versus another immune therapy. They have to know that up front, not send a bill at the end of the treatment. Price transparency ensures that the patients have the patient know the cost, and they have options to choose amongst different medications that are recommended by their physicians. So I think that these are the two interventions: price transparency, choice, and money back guaranteed, that will ensure that our healthcare doesn't go bankrupt with treatments that do not fulfill their promise.